I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
What percent or portion of psychiatric patients are you recommending that ECT is an effective treatment for?
That's a very simple question, which I can't give a very simple answer to. What we are really, and let me digress a moment if I can to try to explain why I can't give you a simple answer. I could multiply the population by the incidence and prevalence figures of individuals with various diagnoses and those subgroups who are very severely ill. However, what we have tried to make clear in our report is that the issue of giving ECT should be made on the basis of the individual patient situation. There are a variety of medical conditions where people can't take drugs. Drugs are often strenuously avoided in the first trimester of pregnancy. Many patients with serious cardiovascular problems cannot take drugs. We think it's very important to evaluate not only the patient's diagnosis, but what his or her clinical situation is, how important it is for them to have a more rapid acting agent, and what other medical or personal considerations must be taken into consideration. Consequently, I can't give you a real figure. We don't know that. And I think that it would be dangerous and probably an error to say that we know that X number of people need ECT in this country. Our whole approach is then is to try to look at it from the individual patient's perspective.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and you might make copies available for the panel. We're talking about having a police-factor information on a device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device, and in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1-pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factual data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun.
Huh?
Out with your gun.
Okay, this won't hurt. It'll be over in just a moment. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it. That's right. Just bite down. Now bite down on it.
Are you ready? Here we go.